Assalamu alaikum wa rahmatullahi wa barakatuh. My esteemed viewers, welcome to another edition of Daily COVID-19 Update. Today we shall be discussing COVID-19 and mental health pandemic. This is a continuation of yesterday's. Um, I have to make a disclaimer here. I am not a trained mental health expert. I'm a and medical and molecular microbiologist by training. But the facts I'm going to give here are well researched, um, are all based on facts. Um, as usual, this is an English language show, but every segment I will stop and summarize in Mandinka quickly. And as usual, what we do, we first start with numbers of COVID-19, as we are here is about COVID-19, and also issues brought about by COVID-19. So we will start with COVID-19 numbers, the statistic. So far, so good, how we are faring. Then from there, we'll go to the actual topic of discussion today. Um, coming for Kiba Control and Mintico, I welcome to another edition of COVID-19 daily updates. Dalam Ahmed Manjang. Bin na topic ko kela COVID-19 anin son de sasa because niya jibe dunia la attention o bebe physical health lekan wala mu COVID-19 coming ken so na lungs nyala wala mu na fenkoti na ka henda min na kufu kafa anin aka mol fanya mi mol be concentrated wala kam yo bari courant do fanam biye mi alon ko abe mol bakan ay mol batan wala son de sasa because kabri min courant na te ko jam fanyola mole si bon ko that in himself is a problem because Adama Dumoman Dada Price we have to go out and socialize and also live it. So as usual, before we get late, I'm going straight to the numbers. Then from there, we will go to the actual topic that is COVID-19 and mental health issues. So as you are all aware, what the Chinese told us that still open to debate that this virus actually appeared in December. I personally think one to believe is far earlier than that. But at the same time, so far so good. 3,106,000 people um, um, are infected with COVID-19, and out of that, 214,000, that's 645 um, 214,645 deaths, and very, very close to 1 million, that is 934,593 recovered. And this recovered population initially, we don't know how their immune system is going to be. But just 3 days ago, WHO confirmed actually these people are immune, to COVID-19. When they say you are immune to a virus or a bacteria or any other pathogen, that means your body already have a program proteins called immunoglobulins, that are there. They are acting as soldiers. They are acting there as a bodyguard for your entire body. Whenever you are confronted with that particular virus or bacteria or pathogens, these pre-programmed immunoglobulins will go into overdrive, go into action and go and clear those particular diseases. Yes, there are a lot of debates about vaccination, especially in a part of the world in Africa. People are very, very skeptical about vaccination. And the comment by two racist French doctors didn't help the situation. But I can tell you what, we better get used to the idea of vaccination because this is going to be attached to how we move around in the world. Nobody is going to let them into their country if they know that if you are not immune. So if you are not immune, they will ask you to do a vaccination, and all these have to be um, satis- certified documents. Like you want to go to US, they say, okay, you need this and this, and one of these is going to be this COVID-19. immunity passport or vaccination cards of. So these 944,593 recovered patients can also serve as a very, very good source of treatment, because already these people, their blood have these pre-programmed immunoglobulins that can attack COVID-19 and eliminate it. So if you give their blood, you transmit their blood to people who are suffering from COVID-19 infections, it can enhance, it can promote, and it can accelerate their recovery. So that's why the British government is already calling on people who recovered to go and donate blood. That blood will be taken and donate to people with COVID-19 infections. To give you like a real life example will be like when Yahya Jammeh was defeated and he decided to go. He was like the coronavirus of Gambia at the time, and we are the general body. So basically, what we done was, to garner more support, then the economic come and help us and flush him out. So basically, this is what the people who recovered their blood, if you give it to somebody, that's what it will do. It will like a reinforcement. So far, the active cases, number of people currently now with COVID-19 is 1,947,462. And out of that number, 1,891,406 people, that is 97% of all the people carrying COVID-19 now are in mild conditions. And when they say mild condition, what they mean by that, some of, among these groups don't even have any symptom. They don't even know they are infected. And these are the most dangerous part of these mild conditions, because these people, they will be going out about really about their business before the social distancing, going to the malls, going to football matches and all that. So once they cut, they will be transmitting the virus. But other mild condition also can be considered somebody with like a headache, persistent headache, persistent coughing, these unproductive cough where you don't actually bring out anything, but you feel like something is sticking in your throat and you want to cough it out, so it's not coming. But there are on rare occasions also COVID-19 sufferers without other symptoms feel that they cannot smell and they cannot taste any food. So this is another symptom that is not properly described. And also, there are other population among these mild condition people. They come out down with diarrhea. But recently, as a few days ago, they add another symptom to COVID-19 called COVID-2. Whereby you have on surface of your toe, especially your big toe, it crops that and start scratching. Once you scratch, blood start coming out. So this called COVID-19 toe. Okay, out of the active cases, 56,056 people are in serious or critical conditions. Okay, COVID-19 serious and critical condition are the group of COVID-19 sufferers who need hospital treatment, who needs hospital admission, and who need intensive care beds, because these people they can't breathe for themselves. What COVID-19 does, it damages your lung, and once your lungs are damaged, their capacity goes down. That means they cannot function optimally. And if your lungs cannot function optimally, that means your oxygen saturation in your blood is below 75, and this is lethal, because once the oxygen saturation is not 75 or more, that means your vital organs like the kidney, like the liver, like the heart, and your brain, will will not be having enough blood supply, and this is how they are damaged, and this is actually how this virus kill people. It cut off the blood supply to your vital organs, and eventually you die. So that's why people go to hospital, because right now there is no cure. I mean, like a specific medication which they can give, which I disputed very much, because I think chloroquine is working. There are research over 20 different locations in China which confirm chloroquine is working. And if you look at this case of Senegal, Senegal have the highest recovery rate in the world. Only two countries are ahead of them. Senegal is using chloroquine. And also what Senegal is doing very well also is testing. They go after the contacts. Once they have somebody positive, they go after their contacts and test all of them. And guess what? They even have their own test kits. Right now, there's a lot of talk about the Chinese test kits is not working, and that's what we have in the Gambia. In fact, just yesterday, the Indians returned large consignment of Chinese test kits because they are dirty, they're not effective, maybe 30% effective. So the Indian return it, but the Chinese they don't like it. But what can they do? This is about people's health. It's not only about money. But Chinese, when you come to money and businesses, they don't have the ethics like other people. That's a fact. We've seen them in the Gambia, how they are even violating our state of emergency laws just for them to continue to hustle and get more money. So this is the situation. I'm going to give those figures in Mandinka quickly, and then we will proceed. But now welcome to another round of daily COVID-19 update. Bimbe min di amela wolomu COVID-19 anin na sonde me dati kende because niya jibe diamo warata damin baka anin kodo jama babe dum kandama anin men program pour sidura kelen. Imam program pour ma jamfanyo. So new work at a yalon neko wa the mol kumul mamandela, and this is a problem. So far, covering virus on new from China in Wuhan provinces in December 2019. Kana sign more millions of more wuli kemeni woro more kemeni wala wala kurang so and more wuli fula wuli tanning nani more kemeni woro tan nani wuli wala fata yo ba more mi yalong ko jari kende asoto nin kurang kono molmi an koye jaari kende a soto kabiri ñin courant starta woɓe mo wuli keme kononto wuli keme kononto wuli tan nanin nani mo keme lulu tan taw worowla tan kononto nin saba wolle jaato kende a so nka ñin jaati kende a min faalera follow ñin kabirin british woli a decide koyeɓe immunity passport deal among many uncle recovered so that is a murunu will go quickly. But at that time, among confirmed for you more ye resistant sort of level for immunity cover resistant. Well, for the balance of around in level. Ibokila no nya dile balo a soldier also to balo la nin soldier on nin kura ye ma balo ka soldier ol dada kama I prepare I program it I program attack. But new Quran attack, it can disappear. They go inside part of your body, come kwela jeka come bero wale keno ko de keren ani dabo ko location on je katarama borindan so that nin Quran yin not what of preparation to you. There is no training. It's like a military. Once you are trained, you are well equipped, you are programmed. New situation or arise that alcohol get up alcohol direct pat ade ta you attack ade je so that so balola nin soldier ol fanan bolo nyame ka domine ko inno globulence nin balo e programme ka parajere nin courant yinnata mo exact courant rek wol be wulla eta ban nin courant kuto nata fo balo e do programme ko rek eta yo ata go fana ina la faka so saya koyta ko mon min alon ko e covid-19 courant so di balo ka soldier ol min dada i ka stay balo kono because courant do be ni ole ma balo la soldier ol min an ko ke programme i bika me is a disappear ko rek dan min sin courant ni ma ko fa ina mo abo wol kono fenke dole nyama flu flu ka je sawsa kana ke mo ke la sawsa kana mo ke yung virus naman sa keno niya but so far na milong min niya so the immunity so Africa more me uncle they are skeptical about vaccination. I can tell you, need after seal Africa man la people know yes you can complain or you can stay away from vaccination. But vaccination is going to be the new normal sign. Need after visa apply labor for eco ibe yelo tare ya jibe for balo I mean to for resistant to COVID-19 ni ma resistant iba for can quota open ko certificate wala the tare visa application can quota you can take this to the bank. This is what is going to happen because New Quran is not going anytime soon. We have to get ready how to live with it. Human Dalhani Jami Follow. Yo, more many along ko courant be la time for me active cases wo be more million killing more keme konon to taworo la tan nani woro la more keme nani taworo ni fula yo will kono more million killing mo keme kononto mo keme say tan kononto nin killing mo keme na ni woro wala situation o bedama man serious ka for mile case ñun ni ko mile case wala mo to mini alon ko dol bije imalon fon ko to rambe so ñun le atinna social distancing necessary da because ni ko social distancing pour mol mini anko courant be le mal be sidula ki ban nin ko mi social distancing je mol kada marasel to mol kada football la min min yana ko courant be le male be taral mo samdi kan do male yo bara nimal condition para do ko min yan ko ka to yin julo bu ka kumpuno tari ake kamera fenne be kan ko nya ko ni ka bondin yo o fana um, dol bije wol kuŋo seedin yo dol bije ika tiso it's not very common yo dol bije wol nin covid-19 yen ka yin symptom dol bije bari ibika fen serano ila karaban jaji ada nyanyi ibika serano ila bisola suka kanje ibika serano nami so when covid-19 na symptom dol ni wo ke dele bije all of a sudden you cannot smell anything yaje o ibika fen test no ila man test your Nibica film smell no is very, very dangerous because hana min manke kurang. For example, Nibica fan smell no ning gas or beli kela bun ko ya data alam. So ni imang from experience la inene ma long ifong pala. Ya jere all of a sudden Ibica fence sierra no Ibica fentes no rek ni the Gambia 1025 call straight away. Yela situation ni explain. Ya the dol ye ni mild condition will kono fanan ke bai yo ni wo bota je mol min ya lon ko yo in courant so do bo lock situation of the dami o garao ta ka to me serious or critical you know wobe mo wulita woro ni woro wulita lu ni woro mo tawu lu ni woro ya jala ni ko karla covid-19 be kara bara garao ta in english wolo minti ko ni bi ka henda ne fa because virus on ya don to la ko ka ko no la ya tinya so fufta fani wole ka fonyo fundinda tele ka dundi nayi oxygen ta atmosphere kono aya sambe balola joyol ko ay ala dow ko keji na pareta komi moto ka isan so jani nyami yo tol balo kono sukuro lo mun na isan so di so fonyo lo mo hit oxygen min non fen ko ni spark min so ni mix direct energy bondi you continue to work and also I elabalo la blood or bill. But I buy protocols like I make carbon dioxide, motor CC bondi la can limit bondi, dolphin and call a bondi in hand at the back. Yo, so nil longs the function in no problem. Ila normal human being now partial blood pressure, oxygen pressure, minka tarala balokon, akatara 75 to 100%. Yo, but nila lungs tinyata, say the lungs la capacity be 25%. And the atmosphere con oxygen min nanga is only 21%. Yana ne ko is a problem. So walan na need at hospital we communicate masingal connect bala ventilator ni respirator mini along ko fresh tango concentrated oxygen 100% oxygen ni along ko ya oxygen collect le ake tanko ko is only oxygen ko yo dot ye correct ika pompi la lungs no ko kura lungs min ba ka sa ita ay balola ba ita kon solta supply because minaka kening balola oxygen level among futa 75 la ila ogando ila balo la suf do min yan ko abe ila biso be nyami ko kilo katila bunyo ibika fonyo soda nyama ni ibika fonyo soda nyama like they start dying ka travel nyama ni ko ran ka mo travel yo ni wo je quickly numbers country most affected I'm running out of time so I'm going to read this only in English 10 most affected countries so far today I have to mention this is a milestone over 1 million Americans are infected, with COVID-19. This is unbelievable. And 18 days ago, this is only 500. So these noble doubles, in 18 days. So expect these also to double in in 9 days. That is without social distancing. The only thing that can stop this from doubling in 9 days is for the American to continue to social distance. But you know, America, yeah, full of idiots. You know, I mean, I've seen people already demonstrating that they are tired of sitting at one place, and we've seen some governors in certain states like Georgia already, you know, stopping their lockdowns. So this is pretty much all. This is what is going to create what they call a second wave, second surge of infection, and this is mainly more deadly than the first one, as records have shown in 1918 Spanish pandemic flu. The second wave, in fact, was more deadly, and that's the second wave also that killed more Africans than the first wave. So America past 24 hours registered 11,903 new cases and 1,065 deaths. Spain registered 2,706 new cases and and 301 deaths. Past 24 hours, Italy registered 2,091 new cases and 382 deaths. And France, the numbers are not yet out. Germany recorded 481 new cases, 51 deaths. England, the numbers are out. I think it's 400 and something, but it's not updated here. So Turkey registered 2,392 new cases, 92 dead. Russia, 6,411 new cases, 73 dead. Russia now is leading, is second only to US when it comes to new infections. But for some reason, their death numbers is very low. It's like they have the same pattern like Germany. Germany also, the numbers are very, very high most of the time, but the number of new dead are smaller. And this is because maybe the Russians, just like the Germans, are doing more tests. The more tests you do, the more positivity you have, and the more you give yourself more time to intervene. That means you catch them before they even develop the symptoms. You can treat them before they go into more serious situations. So Iran has 1,112 new cases and 5,817. No, 71 cases, 71 deaths. China have 6 new cases and no death. This is amazing. And Brazil have 1,687 new cases and 131 deaths. Brazil also is serious because they have an idiot, just like Donald Trump. That Bolsonaro, I don't know, the guy is a nutcase. You know, he actually don't care about this virus, and the numbers are just unbelievable. So after that, I will read the numbers for West African nations. You know, this is very, very scary, and this is right on track as WHO predicted. They predicted West Africa will peak around June, July, and we are just going into May. But there are two countries ECOWAS has to pay particular attention on. It is Guinea Conakry. Guinea Conakry, I think Gambia is far ahead of them when they come to medical facility. I just watched a documentary about Guinea Conakry. You can go to YouTube, Guinea Conakry, and risking it all. The place is a dump, man. When you look at the environment, you know this country is rich. This is what made me really angry about African leaders. You look at the trees, you know that this country, if it will have a good progressive leader, they will go places. But guess what? That country is absolute shit. You know, in fact, just 2 weeks or 3 weeks ago now, their 82-year-old, forced the country to go into a referendum so that he can stay there for another 12 years. But that referendum was poorly advised because after that referendum, Guinea-Conakry's numbers just explode, and now they far up ahead of Senegal. So Senegal so far have 823 new cases, and yesterday, in the past 24 hours, they registered 87 new cases. Guinea-Conakry now have 1,163 registered cases. Guinea-Bissau have 73. This was 50 couple of days ago, so 23 past 24 hours is just too much. For poor nations like ours with almost non-existent medical facility. Burkina Faso have 635, and I highlight this, and 42 deaths. But Senegal have 823 and only 9 deaths. This is significant. We all have to jubilate here. Senegal is doing a pretty good job of this pandemic. And this could be, I know the whole world will be talking about it very soon, because when you talk of Africa, it's all about infection, backwardness, and all. But Senegal is going places, believe you me. Their survival rate is one of the highest in the world. And now they even develop their own test kits that could rival, that of China, or US. China's their test kit progress anyway. Some of them is only about 35% efficient. So, and Gambia, that's what we have. Sorry, I'm not disputing Gambia's numbers, but I think we have to be very cautious. And Mali so far have 424 and 16 new cases. Mali also was almost on here like before 2 weeks. But yet again, another stupid African president decided to go ahead with a very ill-advised decision, that is for them to go into parliamentary election at the height of this pandemic. And you see now Mali, our numbers are also started going up, so it's not very surprising. So 4 minutes for my topic today. That's not going to happen. I think I'll add another 5 minutes just to make 5 minutes. So guys, our topic today. This is a continuation of yesterday's topic. It's about COVID-19 and mental health pandemic. Um, yeah. Right now, most of the media attention, or even countries, and attention is mainly about physical health, and there is more to this pandemic than just physical health. That's why I always think this guy Como of New York City. That guy is top of his game. He's really listening to the scientists. He makes sure the physical and mental health parameter are all taken care of. In fact, he hired over 925, I think, mental health experts, for New York State alone, to help people with mental health issues. You know, so the unequal treatment of the two kind of health, that is physical or mental, is frighteningly similar with our society current disregard for psychological stability. This is everywhere in the world. You look at Gambia, we don't even consider depression or this as an issue. We don't give it the attention it deserves. If somebody has some depression or mental health issues, we think that he's jobbed by these miracles, or he's bewitched by the norms are low rival or whatever. You know, this is a reality. We can get physically sick and we can get mentally sick. It's a reality, and it's about time African countries, put a lot of emphasis on this. So, and mostly also, especially in the world, in the Western world, like places like America, where they have to have a mental, no, a health insurance for them to be able to access the medical facilities. In those kind of community, insurance does not offer real uniformity of coverage, to mental health like they did to physical health. And treatment for mood disorder generally deemed a luxury items. That's a fact. People with mood swings, we tell them this, the guy is difficult, he's irrational and all that. But these are real illnesses, and it's about time African nation invest into research into these kind of illnesses, to help us have a better societies. So, given the fact that we are facing a dual crisis of both physical and mental health, those facing psychiatric challenges deserve both acknowledgement and treatment. Yes, people with mental health issues have to be considered. They have to be acknowledged, and they need to be treated as well. Just like if somebody is in the intensive care with COVID-19. And there are roughly four responses to corona crisis and the social isolations. Why we have this pandemic of mental health issues. Man is not programmed to sit at one place. That's a fact. We have to go out and socialize. We have to go out, watch our football. We have to go out to our pubs and booze, drink hataya, brag to each other like there's any men. And also for women as well, we have to go out social. All of a sudden, 6, 7 weeks, everybody is confined to their house. That's like isolation cells in Yagamis hotel. Okay, so there are roughly four responses to the cholera crisis and the social isolation I'm going to mention. Some people take it all inside and rely on foundation of unshakable psychic stability. Others continue the worried well, who need only a bit of psychological first aid. And the third group who have not previously experienced these disorders are being catapulted into them. That's last but not least, many who are already suffering from major depression disorders have had their condition exacerbated, developing what clinical calls double depressions, in which the persistent depressive disorder is overlaid with an episode of unbearable pain. Yeah, and we deal with different kind of situations differently. Some people mentally are strong, you know, they can laugh this off, or they can go to social media, entertain people, to keep going. Some people will be affected, but they can hardly do with it. But we have a group, the fourth group, which already these people are sick. They have mental health issues. So if you isolate those people, they go into this condition called double depression. So their situation, their condition worsens, and they can go into some serious issues. In fact, just today before I come online, it's on the news that one medical doctor in New York hospital, take her own life. And we've seen also a chairman of one Nice football club in France. No, the club doctor also committed suicide. So these are unfortunately, these are going to be regular occurrences from now. You will see homicides, escalation of domestic violence. I discussed this the other week. You know, they're going to be diverse ways is going, in the road. So these are some of the issues we are faced with. Social isolation generates at least as much escalation of mental illness as those fear of virus itself. Caging people, like caging us. The fear being one place is even more dangerous than the fear we have for the virus. That's Julian Huller. This is an American psychologist found out that social isolation is twice as harmful to a person's physical health as obesity. We all know, what obesity can do to us. Fat people, they are the least healthy people. In fact, being fat is one of the comorbidities of COVID-19. If I say comorbidity, that means an underlying condition that can make that particular virus kill you quickly, or particular bacteria kill you quickly. That's what they call comorbidity, but some will tell in plain English that an underlying medical conditions. So the other comorbidities for COVID-19 are diabetes, heart conditions, hypertension, and also sickle cell anemia. And one of them is obesity. So you look at those Italian hospitals with the pictures come on, you see a lot of fat people, being thrown over, to lie on their stomach so they can breathe properly. You know, for example, solitary confinement in prison system causes panic attack and hallucinations among other symptoms. Hardly somebody goes to those kind of conditions and come back, with all their faculties intact. It's very, very rare. So isolation can even make people more vulnerable to the disease it is intended for stay. Like this social distancing, if it prolonged, this is going to make us more sick. I mentioned this in one of my previous shows that if you stay too long in the house, you don't go in the sun, your vitamin D level depletes, and these cause your immune system to be weaker. And also lack of vitamin D in your system can also cause depression. So you see how all these things are. So researchers have determined that a lonely person immune system responds differently to fighting viruses, making them more likely to develop an illness. Could you imagine that? So it's like social distancing is what they call damage limitation. For example, two football teams like Arsenal playing Tottenham. Arsenal is always far better than them. So mainly what they do is they will park the bus. Stop the goals from flying in. That's what they call damage limitation. So this social distancing it solved the far greater problem, but it also have lot of problem. And one of those is mental health issues, and that mental health issues also can make your body soldiers or the body immune system to behave differently, erratically, that they cannot even do their jobs, and it makes you develop more illness, even less severe than COVID-19. So in order to improve your mental and emotional health, here are a few handy strategies to help you doing this. Yeah, so I'm way off my time, but I'm going to finish this. There's no way I'm going to make these 3 days in a row. So yes, what can we do? Now we are all locked up in our particular apartments. We can visit our friends, we can visit families. So there are things we can do just to alleviate the situations. And I would like to encourage everyone to limit their exposure. Um, Exposure to the news and to customize their social media feeds, by following more accounts and pages that can make them feel good, regardless of the current pandemics. Like I've been mentioning this, these Gambian social media handles, like WhatsApp. WhatsApp is going to destroy that country. I've seen terrible, very, some things that doesn't make any sense. For example, somebody write an Arabic script and there is a voice note saying that if you follow this, if you just look at this, you are prevented from COVID-19. Or you see people dead lying all over the floor. They say this is a vaccination. They inject people in Guinea or somewhere in Africa. These can make you depressed. It can make us sick. So limit your social media outlet, and you choose where to visit. If you know that this particular site make you feel bad about yourself or your community, don't visit it. And if you feel that Al Jazeera reporting is maybe too, extreme, find another channel. And also limit the news actually. You need to do something. If you don't, you read the book. Or you go to YouTube and listen to your favorite reciter of the Quran, or you listen to music. If you don't like SD, you go and there's, so this is how you manage these kind of situations. There are a lot of things. In fact, our brains are built to solve problems. We know that brain does their job to solve problems. But when you are already feeling fearful, like you fear something, the brain naturally seek out a stimuli in your external environment to enforce the feeling of fear. So for example, you went into a room. They said, well, somebody come and say, oh, I saw snake here. Just send your brain into overdrive. It's going to activate things that will enhance that fear, because this is what they call fear and fright. It prepared you to go into defensive. So basically, in that kind of situation, like right now, we are all scared. If you go out, go to the supermarket, you come back, you start thinking, now, okay, that trolley I thought maybe somebody before me, is COVID-19 positive, or the tealer that served me maybe is COVID-19. Start thinking about it. So brain, that's why it goes. So the brain then deletes, distorts, and generalize all incoming information that does not align with your current emotional state of belief. For example, you are in a state of fear. All the positive things that come to you, your brain will delete them and put them aside. So you see how depression comes. If you don't give yourself time, all you are stick to this news media, or you are in the fight continuously with these beauty people events in social media. This make your brain in that kind of situation. So the good things that come in, you just delete it and concentrate on those bad things. So that's why we should help ourselves and concentrate on news outlets that will make us feel better. So if you spend a significant amount of time following the news, it reinforces more reason to worry, thus creating a vicious circle. So our consumption of news, unfortunately, is everywhere. You can't escape it. But we should be self-disciplined, and consider our mental health, and look at the channels or platforms that will give us positive information. Some legitimate and reliable sources for COVID-19 related news and updates include the Center for Disease Control and Prevention, like the CDC, and World Health Organization, and also Johns Hopkins University, Corona Research Center, and Food and Drug Administration of the US. So, but there are other outlets which are bringing all kind of false information, conspiracy theorists, leave them. They will make you feel bad. You know, those who think the hate is equal, is out to destroy the whole world, which is far from the truth. So it is helpful to adopt a more analytical approach as you follow news reports about the coronavirus. You also want to verify information that you receive from family members, friends or social media, say the Americans. Like last week, I've seen one video. This was taken in New York. This was embarrassing to tell you the least. And I cannot believe somebody who's in the US for 20 years or so shared this information. Because this Senegalese guy, I think New York State, they were clapping the medical staff, the frontline staff. They are clapping for them in the evening. He came out taking the video. He said, "Oh, the solution to COVID-19 is found. Start praying, broken English, but I hope Senegal also found." It was so embarrassed. So these are the kind of information. Once they come, delete them. Don't waste your memory or data. So moreover, consume only what you need to know, what's more relevant to you, and particularly what is happening or anticipated in your community. That's what you should be doing. Also, maintaining social network can foster a sense of normality and provide valuable outlet for sharing feelings and relationships. Call your family, speak to them. We are, in fact, that's the problem I have with this social distancing discussion. We can connect socially. I think it should be, properly level as physical distancing because we can connect socially. You can speak to your loved ones, spoke to your colleagues, at work who you don't see for, weeks now. This can make you feel better. And you can contain this connection without increasing your risk of getting the virus by talking on the phone, texting or chatting with people on social media platforms. That's the beauty of modern generation. We can make the best use of the social media, using that to connect with loved ones that we miss because of these um, 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 lockdowns. In addition, you can take virtual tours together of museums. We have these online. National parks. You can go on site via Google Arts and Culture. Yeah, this Google Arts and Culture is a very very rich resources about museums, national parks, and other forest parks. You can visit and tune into live stream concerts and other events or play online games with friends. I'm not a very good fan of online games. I think they are addictive. They are like drugs. Not to mention, I have to be honest, I'm always in them anyway. So, but I think they are addictive. So, in this kind of situation, you don't want to, be hooked to something. That after the lockdowns, you cannot even go out because you are already addicted to these video games. So, if the symptom of stress and anxiety get any worse and you feel it is impacting your ability to function, please speak to an experienced mental health professional at the highest. I'm not a professional mental professional. You should find one every community should have. Unfortunately, Gambia, I don't know even the numbers, how many of these we have, and if you actually have these helplines whereby you can call to seek help. So for anyone who is also about attending therapy sessions outside of home, especially those who the Center for Disease Control has described are being addressed, you can ask your health care provider about the therapy or mental health services. That is the end of this trade show. So I just summarize quickly in Mandinka and we can go from there. So thank you all for listening. Always, I beg, please share these videos so you can get to as many people as possible. Nka min foti ba kan wala lam minti ko min COVID-19 kuran min be kere wala albala dunia mul concentrate ba ke min ka wala physical health because physical health wala ka kariya mo fa yo bari sonde me sasa mo jama man taro mon son kan min kule dunia lon ko ala condition o do je sa yare kana yefi sawati so wala na nyanta kala kule mo nyanta concentrate la kan tol kan ma kan la africa mi alon ko min sonde me sasa na ke ta mo if I feel moral wala basi na ya ke ko it's not always that thought and value that sasa and that includes and so no sasa amin ka jawandi wa wala kono ni self isolation ni ba kan ni lockdown adama dimo ala man program pour nga tara sirin di yake adama dinga ya dadale pura e wula ita ala balu mina ina muno adama dinga ya dadale pura ninga moli adama biya so yaji so ni wobe kunduda hani na jani to anin na kyoso to buka ta muji ida ma de kan yo adama do ni da ma si je fana ko wi balu la soja ro fana ka sunu wala nyama buka la ko kana nyama ana sake hani virus min da covid-19 fa asadi na kariya kiyama model DJ kakul ta different the model DJ you think is your whole among who think that it bring the best out of them actually. But some of them are the new candle of the one but gold yemi alonko janni nyim bon kono si fan kana woli e son de message out of the news you can ko communicate with the whole the depression akila asan you was the video so you to care but quickly ning sonde me sasa kana ya fantum doctor so le min alon ko do ko min koite ning ko mi kuran ning ko pandemic ko kono ibi ko function no ibi ko wuli no na ran kan so man de ka tun no na and you la ni tare do ko la sino bi ko kono it's about time you mental health doctor in contact Gambia malo fue sotole bang and near soto kanon fue line sotole mo semi ko no bang I have no idea but in the western world these lines are there you just do the yeta tenko yo semina da keno pulka nyimbun kono sio ka kosen di pura kana no sonde no sa sa abu wol kono ise ina mol kon no through telephone wala mun modern bela biggest advantage you can call isila badi will call no ila low console ko ila do ku yol min along ko min covid-19 ya tin do ko last of that you can speak to them yeah, yeah. But can go for a neater online like Google's social media can go sort of me along ko music or video online live streaming program and so video all you listen to ila favorite account ila video to YouTube ya play wala audio you listen to them you be there to fit it ma ko but me along ko important da baba ka kan wala news kibaro tala da min ka ta kibaro asin na silo ni masala fa no kuran ne so waɗannan kibaro ñanto kañal na miyaji be sonanda yeɓaɗo konaji janno just before la ko yaji ko wato wat mus binara bon non ngam faɗo bana ngam le ko new cases nombol bitala gon ninki e silande andum brain ka kenya hadama wala konke on ka tama ñani wala ñinti ko min ko mi silata ten di ada tela concentration akelo silo na kole la akatar wala gaita so nin silo bada jere ki ala ite kanala no wala nin fama ni na ite kanala no so ilo sila wato ko nin mo be silari ya jelo ibika ibalo ila positive things on min na dia kilo kan brain ko di be ka e fay so akatar concentration silo ni so wala na sila ko be da mo mo ta to wato wato Okay, aling kibaru mi along ka be jan kan sako Afrika banko kan kibaru do ka mane ba ka do ni ki ko ko na do ni ko gino mo be la rindu ma sort of blood bag be do do kan da be ko kan ko be mi along ko COVID-19 kan ko ai be that is scary wo sa tin na fa mo be so ko ye pare ka ta lo tan ni wa do ko wa islam mai be ni da je ben ko and being a caricature do say na timeline to pretend was something last sending even though I turned videos back on the entire community baba yala kama so nyimbu Nigeria leti ye person ya bulo mu da kai ko ibalo candidate he was trying kakana kono wala bala kando siride tali kono lasi la wala lasi wala among to kai COVID lasi so what that when can we explain well and unity already Nigerians are running away from hospitals no it's a disaster I mean me for sila ning kibara katanyani abitala fo mo tela fila fo mi dena la fela dena no le la yindi ya fon ko da mi o man ke dena saya min Afrika ya so da ba ka na ta kala ta saya respectable level ajina nguru ne ko de bana mo tan ko so inshallah, tomorrow the announcement and the disclose soon agree on that follow. But we will be here inshallah maybe COVID-19 so I'll give you a news here at the timeline okay through information about as many people as possible. But thank you very much. Allah
corona, 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 Fantanga, corona, 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 Uranjau balemu, alnangambuluku, jisene uninsafuno, nganke kumoja mato, mambulo bonde nyadala, dolko tubabu sasa long corona mana fatam fansila, akil tu fantanko le fisi ajarala. Mote bala totola ni betotola da samakara la. Mote bala tisola ni betisola tisuke dabala. Akil tu bultiyo nga walandi karala. Nganke ku fantanko le fisi ajarala. Corona, corona, yeah. Corona, 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 Fantanga, corona, 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 Uranjau bale, ñu rahas lo hoyite ñu moytu mbolo, bahel corona ndax li am na solo, moytu ñuy saxate ba joxe loxo jël safety precaution li fokk rek ñu wax ko pour ñu am symptômes yi xam ko ñu mëna bàyyi xel dafa easy ñu am ko, lalante kanam ñu fexe ñu bàyyi ko sooy jël precaution dafay jafe nga am ko. Callal 1025 so amee problème si sa nokki bi danga bàyyi xel si fever bi ak saxaat yu bari. Sapata jarala, nduna sakabata jarala, la jota jarala, oh, corona, 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 Fantanga, corona, 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 corona.